I appreciate you coming in here, man. Your first time here with us. All right. Have you ever been to a foot doctor for these issues?
No.
Never. So how long has there been a problem for you?
Quite a while.
Quite a while.
Quite a while.
Quite a while? Have you done anything yourself to help it to get better?
Yeah.
What did you do?
Put fungal cream. The kind of stuff, over the counter stuff.
How long did you do that? Over the counter
For a
stuff?
long time.
Did you get any improvement at all?
Oh, yeah.
Okay. I see that.
Come right back.
See, creams typically don't do well on toenails because they don't penetrate the toenail and get down to where the infection is underneath the nail. So typically they do not work well at all. Okay. So we're going to need to do something a little more aggressive. Again, what I'm doing here is I'm taking nail samples.
Yeah.
I'm going to send it to the lab. And the lab is going to let us know exactly which fungus is causing the problem.
Which one?
Yeah, there are many different organisms that cause this problem.
Yeah.
And so we need to know which one we're dealing with so we know the best way to get rid of it. And that's called taking a culture. Just like any other type of infection. Once you know what bug you're dealing with, you know how to get rid of it.
It's a bug in it?
Well, not bug like an animal, like an insect, but bug like a germ. Okay. See, fungus is related to molds and yeast. Got it? There you go. Got it. I have to squeeze on this one, or that corn between your toes is pretty sore.
That's a corn.
Between your toes.
That's a corn?
Corn, yep. C-O-R-N. We'll take care of that in a second. Taking this instrument called a curette and clean under the nail. See all the stuff that's coming up?
Yeah.
All right. This is fungus, dead skin, moisture that has accumulated over the years. Which is why this is hard to get rid of. It's one of the most difficult to treat issues that we see in podiatry. Because it takes a long time to get rid of it, no matter how you deal with it, whether you deal with it by topical medications, that's just medications you put directly on the nail, or if you take medication by mouth or laser, whatever it is, it takes it takes a long time to treat it, because what we're actually treating is not the nail we see today, but what we're treating is the nail that's coming in. Okay. The nails we see here today, those changes are permanent, which is why we have to be pretty aggressive to treat the new nail that's replacing the old nail. Nails are in a constant state of growth.
Right.
And the problem and the frustration people come across when they try to treat stuff at home, particularly stuff over the counter, is that, things don't penetrate the nail, and then it takes a long time. Most people want this thing to be over with in a few weeks, but it takes months, almost in some cases a year, to get rid of this, no matter how you treat it. Any of these nails cause you any pain?
No.
No? No problems wearing shoes?
That corn between the baby toes, that cause pain.
Yeah. I'll be taking care of that in a second. Now, another thing that people fail to do when they're dealing with this issue, whether it be nails or the skin, is that they don't understand that the infection is just not on the feet or just not on the toenails, but it's also inside of shoes.
Oh shit.
So what you have to do is disinfect your shoes.
How you do that?
And you do that with either a shoe spray or disinfectant, surface disinfectant, that you use like you spray your counters with.
Yeah.
Okay.
Lysol?
So Lysol, something like that.
Mm-hmm.
Spray out the inside of the shoes when you're done with them for the day.
Spray the Lysol?
Mm-hmm. On the inside. Remove the insole.
Yeah.
Okay. Spray the inside of the shoe. And leave them out. And don't wear those shoes again for a few days.
Oh,
all right. So when you're dealing with this issue, well, you shouldn't wear the same shoes all the time anyway, whether you have a fungal infection or not. Because you got to give shoes a chance to air out and dry out. Because if you don't, while you're trying to deal with this, it's just going to be there. Okay? Go. Again, see all this buildup here?
Yeah.
All over here in the corners.
Yeah.
All this is almost impossible to deal with just a cream. And that's why a lot of folks think that this problem is not curable. And the reason why they think it's not curable, because they've been doing it wrong.
Wrong.
Their approach has been wrong. The medications have been wrong. They haven't verified what the organism is to make sure they're on the right track as far as treatment is concerned.
I understand.
the girl from here? See right in here?
Yeah.
Underneath the nail, this is called the nail bed.
Nail bed?
Nail bed.
Yeah.
So it's where basically where the nail rests. So what we call the nail bed.
Uh-huh.
So what can happen is over the years from the thick toenail,
Yeah.
you can get a buildup of skin just like the callus over here on the side. All right.
That's
So
it.
so if we don't shave this down regularly until the nail gets back normal, the nail's just going to stay lifted. If the nail stays lifted, fungus, bacteria gets under there, moisture, and just keeps the problem going. So this nail bed needs to be kept as thin as possible. Okay?
Okay.
Yeah. There we go. See how we're cleaning this down? There we go. See that?
Yeah.
Okay. Now this one's even a thicker
Yeah, I see it.
layer of skin on the nail bed.
I see it.
So we're cleaning all this down. See how it's coming down now?
Yeah.
So we want to do this to keep the nail from lifting up in the air.
Okay.
Because we want the nail to have a good firm attachment to the nail bed. That way as the new nail is coming in, it's not lifted in the air and allowing moisture and fungus and stuff to get up under there. Exactly. This comes from having a stiff toe joint.
Having what?
A stiff toe joint. You see this big bump right here?
Yeah.
That's a bone spur.
That's a what?
A spur, a bone spur.
Uh-huh.
All right, so when I try to move your toe to the normal range, it sticks right here. All right, it's because of arthritis in this joint.
Yeah.
So as a result, you get a lot of pressure here on the side when you walk, and that gives you the buildup of this callus here. So the thing, what we have to do is shave it on a regular basis. Sometimes folks have to use a wider shoe. Putting padding on it is very effective. Okay. All right, then get you all squared away. And then you have to file it down on a regular basis at home. You use a callus file or pumice stone. Okay, nothing sharp like I'm using here. You don't want to use a blade. You want to leave the blades up to your doctor.
Okay.
Don't use blades at home. You injure yourself. Okay.
Okay.
So we will take care of that until things get back under control. All right. Yeah. There we go. Coming along well. See that? What's good about in this one, there's no core to take out. No. Sometimes we'll see it, there'll be this little hard piece of skin right in the middle, and we have to dig that out. But not in your case. So that's a plus.
That's good.
Yeah.
Why keep going back, man?
Well, because what's causing it hasn't been addressed. You still have this arthritic joint. You haven't been padding it or anything like that. That's why it keeps coming back. So same thing on this side. All right, the big bump over here, the bunion. Stiff toe joint, leading to an increase of pressure over here on the side. So with every step, you're getting pressure, you're getting friction, it's building this callus up. Okay. Yep. And same thing over here, you don't have a core on it, so there's nothing I have to dig out. All right?
All this time I'm thinking, I'm scared, thinking it's a core.
Nah, nothing to be scared about around here, man. Just come on in and get the work done. There we go. So this is the issue that's causing you the most pain, right?
Yeah.
It's corn here between the toes.
Exactly.
All right, so it's just on your little toe side, which is good.
Yeah.
Sometimes we'll see it on both toes where the toes come together. So what it comes from is from the toes rubbing together all the time.
Right.
Just like you have here on the outside, on the inside of your big toes. Same thing, pressure and friction. And over time, this builds up. And then because of sweating, you get the moisture in between the toes. So that just makes it even harder to deal with.
Yeah.
All right. See how I can get some of this stuff out of here? Particularly deep within. Okay, see all that? Or maybe you can't see it from your vantage point, but
Now they're coming out.
yeah, a little bit. And then deep well of the inner space here.
The what?
This is called an interspace. Space between toes.
Is it cut down there?
No cut. So this is all just like over here on your big toe, pressure and friction. And over time, it can cause pain. So your issue is on your little toe side.
Okay.
And we're gonna shave it down here in a second. And what you'll have to do at home is what we call a toe spacer. A toe spacer is a piece of foam or a piece of silicone that goes between the toes.
I gotta stop.
It'll take some time, but it'll definitely help it to get better. Now, what you want to do is be sure you keep very still because this blade is very sharp. Okay? And sorry about that. I know these things are painful. Yep, sorry, buddy. But it's coming down pretty good here. It's going to feel a whole lot better when we're done. There we go. Coming down well. It's coming down very well. Now this one does have a little core in the middle of it.
Has a core?
They typically do.
What that mean?
What it means is that there's a focal point of pressure causing a little pinpoint area of pain right in the middle.
Yeah, exactly. You gotta get the core out.
No, I don't have to dig this out. I'll just be able to shave this out. It's very difficult to dig these cords out between toes.
Yeah.
Here we go now. And they can be a little difficult to shave because over time, from all the moisture between the toes, it can get kind of spongy. It just doesn't just shave right out. Things are looking much better here, brother. It's little baby toe still. Okay. Things are looking much better here, man.
Yes, it is.
All right.
I see that.
So, remember everything we talked about. I'm gonna give you some things to take home with you.
Okay.
All right. Number one, use the medication as directed. I'm gonna prescribe a cream for the bottom of your feet, for the athlete's foot.
A cleaner?
A cream.
Cream.
Gonna go directly to your pharmacy. Number two, alternate your shoes every day. And the shoes you're wearing, you disinfect them at the end of the day. Okay? You want to make sure that you're not reinfecting yourself. If you don't do that, I don't care what type of treatment you use, it's not going to work. If you're wearing the same shoes day in, day out, and you just keep adding the fungus right back. Number three, when dealing with these issues,
can I spray the shoe with fungal cream?
yeah, you can.
Fungal spray?
You can.
That
You
work?
can. Yeah, that'll work. As long as you're doing it at the end of the day. Okay, making sure you get it. And then leave the shoes out so they can air out.
Take the toes off.
Mm-hmm. And then number three, you gotta be patient. These things take a long time to deal with. All right, especially toenails. It could take up to a year, depending on how bad the toes are to begin with. All right, so don't give up too quickly.
I don't do it.
All right. So cream I'm prescribing for you today. Don't use it between the toes.
Don't?
No.
Okay.
Only thing you want to use between the toes are powders and sprays. That's because they go on dry and they stay dry. All right, you try to put a cream between the toes, it's going to stay wet all day.
Right.
And then that's going to continue to create issues, especially here where you have that form.
Okay. That's good.
Yeah.
Spray.
And be sure you spread your toes apart. You're just trying to pour it on top and hopefully it work its way in. It's not going to work.
Okay.
All right?
Yeah.
All right, man. How we feeling?
I'm feeling good, man.
All right. Very good, man. Looking much better here.
Yeah.
All right. So you'll hear from me in a couple of weeks.
Okay, go.
We'll have you come back in a couple of months and keep this show going.
All right.
All right, my man. Very good.
Very good.
All right, give me some of that help. This is Kevin Jefferson, the DC Foot Doctor. Thank you for watching this video. Like it with a big thumbs up to see very interesting cases and my approach and techniques to dealing with them, and to learn how you can improve your foot health. Subscribe to the channel. Ring the bell so you will know when a new video has been uploaded. Follow me on social media at DC Foot Doctor. Most importantly, take care of your feet.